Hello and welcome to Stand in the Gap. I'm Sam Rohrer, and I'll be joined today by Pastor Isaac Crockett. On this program, we regularly emphasize standing in the gap for truth. We emphasize the importance of truth in society as it relates to the horizontal, interpersonal human relationships and the vertical divine relationship to God. We've cited many times that God says in John 8:32 that it is truth alone that sets one free from the spiritual bondage of sin, of course, but also from the physical bondage of totalitarianism and injustice, and from intellectual and emotional bondage of capricious and changing, quote-unquote, facts in science, arts, law, and medicine. On this program, we regularly state that there is no truth outside Jesus Christ, who says He is the way and the truth and the life. And on this program, we've cited the sad fact that as an American culture and as individuals, we've walked away from God as the source of moral truth. Our highest institutions of government, as an example, have redefined God's definition of truth many times. The Ten Commandments, life, marriage, human sexuality, all redefined. God's standard of justice and our Constitution's controlling definition of rights and duties are redefined. On this program, we also have reminded you, our viewers, that God has said repeatedly, as in Deuteronomy chapter 30, He says, "Follow my commands and embrace my truth and choose life. If you turn away and follow your own way, then you will perish and you will end up choosing bondage and death, and you'll lose your prosperity and your freedom." People are sensing that a lot is wrong with the COVID policies, as an example, that's affecting our entire culture, and in part because the definitions of terms or recommendations and guidelines and policies, which they continue to change by the week, if not the day. Like good health, which focuses not on symptoms, but the problem, I've described the problem here for this program as recognized truth and science in established medical practices of testing, diagnosis, and treatment are being strategically dismantled in America. All ties into truth. On today's program and next week in part 2, we want to illustrate the process and the consequence of rejecting truth generally, and due to the vacillating COVID-19 policies, actually watching the destruction of the integrity of health care in America, as well as quickening our loss of not only health freedom, but civil freedom. Our theme for the day is When Truth Falls, Health Care Fails. The lessons of COVID-19 policies. Our special guest is Twila Brase. She's the president and co-founder of Citizens Council for Health Freedom, and we're really thrilled to welcome in right now Twila Brase to Stand in the Gap. Twila, thanks for being with us today.
I'm so glad to be here, Sam. Thank you so much.
Twila, you've been with us on our Stand in the Gap Today radio program many times, and so it's great to have you on this. But let's get right into this if we can, because COVID policies are dramatically changing everything in America. We know it's destroying the economy, it's uprooting kids' education, livelihoods, and so forth. But truth we've talked about is really absent in so much of what we're seeing, and I want to take this and apply it here. If you look at the COVID policies right now that are so disturbing America and confusing everybody, what would you say is perhaps the biggest major problem that we ought to look at as we approach this issue right now? What would you say?
Well, I think the problem is that we have forgotten what the strategy was. The strategy was that we would flatten the curve temporarily. And then that was just to make the hospitals prepared for the COVID patients that would come in. The strategy was never to avoid the virus. It was never to stop the virus. It was to prepare for the virus because the virus is so infectious. And so, it was supposed to be a temporary, but now it has just extended, and people forget that. They think that what we can do is we can stop this virus, and they can't. And I think that that is leading to all the fear that we are feeling today across the country, and all of the ramifications and all the strategies that others are doing in order to stop the virus rather than just temporarily stall it.
Well, that's interesting because you say that the goal was originally to level But now we've shifted to a long-term process where we're attempting to prevent a contagious virus from expanding, but we can't do that. That's what you're saying, right?
Yes, we can't do that. Indeed, some people will miss it because enough people will have gotten it, or the herd immunity, which I call community immunity. Enough of that will have enough people around the country will have gotten exposed, will have gotten it. It will run out of the susceptibles. And at that point, the people who are left will not get it. And so those people that are the people we should be protecting, and those are the ones that will get severe COVID. And for the most part, that's going to be the elderly and those with comorbidities.
Okay. And Twila, great setup for the program. Ladies and gentlemen, we're going to break away for just a moment and be back. And we're going to talk with Twila about some of the other things. We're not just moving from leveling. We're trying to contain something which is not containable. But we're also talking about terms, cases. We're talking about mortality and death rates. But what's the truth about them? We'll be back and we'll talk about that in just a moment.
Truth, flexible or permanent? The Bible, ancient history, or powerfully relevant? Culture, a reflection of enlightenment or warning signs? The pastor, commentator, or frontline combatant? Every day, American Pastors Network speaks to these questions where and when they matter. With hundreds of affiliate radio stations nationwide, a website and mobile app screening today's headlines through the twin lenses of the Bible and the Constitution, educating, informing, equipping. This is the American Pastors Network. The time is now to stand in the gap for truth.
Welcome back to Stand in the Gap, and today we're talking with a friend and someone who's on our radio program with us regularly, Twila Brase. And Twila is the president and the co-founder of cchfreedom.org, or the Citizens Council for Health and Freedom. You can also find them on social media as well. But Twila, thanks so much for being with us as we talk about healthcare, and you already brought up some of the difficulties or confusions of what's going on. I thought of a verse in Psalm 71, the very first verse of the 71st Psalm. The psalmist writes, "In thee, O Lord, do I put my trust. Let me never be put to confusion." And yet with what's going on in our country right now, and it was going on before COVID-19, but especially right now with what we're hearing about COVID-19, I feel like we're being put to confusion. And you mentioned what's going on where they talked about flattening the curve, and now they're saying, oh, we can't catch it. And I think on our radio program you mentioned that it's kind of like they've moved the goalpost on us, and they just keep moving it. And it seems unfair, it seems almost deceptive. And one of the things that you've brought up is that we need to be asking the right questions. If we don't ask the right questions, we'll never find out the objective truth. And so as we look at the asking of the right questions, let's look at some of these terminologies, starting with this idea of cases. We see in certain areas, certain states or communities, the COVID-19 cases are increasing. Is that something that we need to be worried about, or is this part of this moving the goals? Is there some deception involved in there? Can you help us find the objective truth even in this realm?
Yes, so I think there is so much wiggle room in the word cases. So there are confirmed cases, and confirmed cases are those who they have actually found a piece of COVID-19 in the testing. But there are other cases now that the CDC has added called probable cases. And those are cases that are not confirmed. They've never actually had a true test to confirm whether they have it or not. They have a variety of different things, like they have two mild symptoms, plus they've had a positive antibody test. But the antibody test is notoriously unreliable, and some states have decided not to report probable cases because they don't believe in the antibody test. And yet other cases are reporting probable cases all commingled with the confirmed cases. And so as some commissioners in Texas were worried about, the case numbers would shoot up 17-fold, and they were concerned that their people would think that the pandemic was starting all over again. And so the cases, we can look at deaths too, but just for the cases, you have to look at it with some wariness of the numbers.
Okay, so you said we have to be wary of the numbers because some people are calling something a case that others wouldn't consider at all a case. And again, you've been in the medical field for a long time, and so normally in the medical field things are so exact and so precise. And now all of a sudden, and again, that's kind of the moving of the goalpost, maybe part of this confusion that we're hoping the Lord will deliver us from this, even using our program today to bring clarity to this issue. But you also brought up this other term, deaths. And we different ones of us have friends or different extended parts of our circle that have a family member who has died and ostensibly from COVID-19, or they're related, they're considered this COVID-19 death. Is that term being used correctly, a COVID-19 death?
So there are two things in that, and one is that the CDC very early in COVID-19 told doctors and those who fill out death certificates that they could presume COVID-19, and they could therefore add it to the death certificate, even though they weren't sure that the person had COVID-19 and that the person, the decedent, had never been tested for COVID-19, and so they didn't know. So that's the first thing. The second thing is that they're now also have added this probable COVID to the death count. And so the very same thing, they can consider that the death is probable due to COVID. And then I think added to that is just what the Illinois Department of Health said to the press in a public statement. And this is paraphrasing, but essentially, if you are known to be terminally ill and expected to live for only 2 weeks, that's just an example, right? But you are also found to have COVID, you will be listed as a COVID death. She actually said that even though they know you have died of an alternative reason, if you have COVID, they will count it as a COVID death. And so, of course, this could just exponentially increase the number of deaths for COVID that are being reported, and so therefore unnecessarily scare the American public about what COVID really is or isn't doing to people.
So, Twila, basically, you didn't say it, but I'm going to say it. There's a big difference between dying because of COVID and dying with COVID.
With COVID.
Okay?
That's correct.
Now, let me just ask you this logical question here. Because the media is focusing on the increasing number of cases and probable cases is now factored into it, deaths are now many COVID deaths with COVID as compared to because of COVID. We now have deaths and cases that are intermingled and mixed. The public has no really idea, in simple terms, what happens. You used the word panic, but I want you to expand just briefly upon it. When truth and preciseness is not used in how we classify, diagnose, or in any of that, what happens to healthcare generally, and what happens to the integrity of the entire system in the country?
Well, I think that, of course, what happens here is that there's just a fear. The fear just grows to the point that people want to know how they can not be one of the cases, not be one of the deaths, what they can do to protect themselves, but also what you who must do to protect them. And so we get to this point in our country now where the lockdowns are coming back. They were lessening, but now they're coming back. All these mask mandates are popping up around the country, even though what we could expect and should expect is that the number of cases will increase because you are testing more people. And so even those who are asymptomatic, those who are mild, they're all being found to have had COVID. Although if I can just say a caveat to that, there are people, particularly with the antibody test, who think that they have had COVID, but they've actually had a different coronavirus. So they think they've had COVID and they haven't had COVID. And so, this is all, some people are relieved that shouldn't necessarily be, and other people are scared to death without a really good reason because we don't have, really the truth of how deadly this is. And just to add, COVID-19 is severe. For those for whom it is severe, it is truly severe. But it's really important to realize that is truly a minority of the people.
All right, before I go to masks, because you brought it up, and I want you to talk about the efficacy medically of masks, is just one final question. Should people, when they see and hear, cases are increasing, is that actually good news because cases are increasing, because we know that it is making its way through the population, which leads to community immunity, or because there's more testing? Or is that a fearful thought? Put that into perspective for our viewers.
It should not be a fearful thought. We should expect that this little tiny itsy bitsy virus, which we cannot stop, would infect more and more people. We should be glad as we see that even though the number of cases go up, the hospitalizations are going down, the deaths are going down. And again, we don't even know what the deaths mean, but we should be glad because we can see the hospitalizations are going down. And so, yes, so there should be less fear and there should be more, I don't know, relief is perhaps not the right word, but just understanding that we should expect to see the number of cases go up.
And
it's not a bad thing.
Yeah, and Twila, just what you said right there, ladies and gentlemen, as you're watching, the truth sets one free. That's John 8:32. It's what he said. Truth sets one free. Relax. Relax in this whole issue, because when we understand the truth, and if we were to be told the truth, we could relax, and that's exactly what God tells us to do. Be anxious for nothing, and including this. Now let's go back on masks, Twila, because we have governors, some are saying you've got to do it, because it is the best single thing that can be done to prevent the transmission. But you just said the transmission is going to happen anyway, and that's not necessarily a bad thing. So why do we want to wear the mask? And is the mask efficacious in the medical terms? Does it work? Or if it doesn't work, why doesn't it work? And put that into perspective, please.
So I like best what Dr. Michael Osterholm at the University of Minnesota said about masks. A lot of people are doing things for emotional reasons, not for scientific reasons. And the mask is really all about emotional reasons. It makes them feel like they are doing something, like they can somehow protect themselves. But the fact of the matter is, he says that an N95 mask is the only mask that can protect. An N95, and which means, it means you need a whole lot more oxygen happening in your environment than you get if you just clamp it on the outside. So a cloth mask is known, as he says, according to a study, for letting 97% of particles come through the material. 97. It only stops 3%, which is probably the very big particles. But of course, it doesn't stop anything around the edges. Around the edges of the cloth mask, it's 100% stuff going in and out. So it does not protect. The World Health Organization says there's no evidence that it protects anyone, or that mass community masking will protect anybody from COVID-19 or other kind of respiratory viruses, because they're all very, very tiny. So the mask is really something that people are doing more than anything to make each other and themselves feel comfortable. And therefore, it should not be mandated as though it was protective. And Dr. Osterholm and others, including the World Health Organization, are very concerned that the mask will make people not do what actually protects them, which is distance, 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 as he says. So having distance and hand washing are probably the two most protective things that you can do. But when people put on masks, they get closer together, they forget about hand washing, they touch their mask, and then they touch their eyes after their mask. And so, yes, masking is kind of there's not truth in the mask protecting you, not really.
Well, Twila, you made it clear, and ladies and gentlemen, I hope the program, unfortunately, is not that long. So we're hitting on just a few of the critical issues, but the purpose again for today is talking about when truth generally falls in society, then as it relates to healthcare and the integrity of the healthcare system will fail. The truth sets one free. We're trying to present some medical and scientific truth to you, and hopefully already you're saying, breathing a little bit of relief without a mask. And with that, we're going to be back in just a moment and continue and kind of summarize some of these things here today with Twila Brase, who's our special guest on this program.
Stand in the Gap is produced and recorded in the studios of WBPH Philadelphia, positively different television.
Welcome back to Stand in the Gap, and we are discussing this issue about truth and healthcare. So when truth falls, then healthcare fails, and we're looking at lessons that we can learn from the response to COVID-19. And our special guest and friend is Twila Brase. She's the president and co-founder of Citizens Council for Health Freedom. Again, that website, cchfreedom.org, and they have social media and different things that you can go watch videos, as well as Stand in the Gap. You can go to our archives and listen to regular radio programs we have with Twila, talking about some of these issues. And so, Twila, as we finish this up, you as a healthcare professional, looking at this reaction that's come about to the COVID-19 situation, what kind of information would you like to pass on to our viewers, as well as maybe encouragement to other healthcare workers that they could come out with the truth? So much of this is saying, what are the objective facts, what are the scientific medical facts versus what are the emotional responses? And what would you encourage those involved in the medical fields, our healthcare workers, what can they do to get the truth out?
So doctors and nurses are trusted sources of medical information, but I think a lot of them are scared because of the situation that they are having to deal with COVID-19 patients, and they also probably do not understand the cases and the deaths and the statistics and how much wiggle room that there is in there, or that aren't actually facts at all. And so I would just say it would be good for people to even talk to their own doctors about what they learn on this program, about the facts, and then let those doctors help their patients then by learning better facts, not be so fearful. Because the problem as a country economically, even access to care if you don't have COVID, but you've got like cancer or something else, all of that's being hurt by the fact that we're all living in fear rather than in facts. And so really getting the facts, watching our COVID-19 update videos on Facebook, on our Facebook page. I try really to bring facts, statistics, charts, whatever there is to help people understand what's really happening with COVID-19.
And Twila, you do that, and you do a very, very good job. And I just want to thank you for being in that space. We're all concerned, I think all of our viewers are concerned about freedom. We think mostly of our civil freedom when we are locked in our homes, as we have. That begins to make that issue real. But we're talking about health freedom right now. And when truth is not followed, it makes it really destroys the confidence in our own docs, in the system. And that's not what we want. And so, ladies and gentlemen, as we approach the end here right now, seek truth. Can I encourage you? Seek the truth. Talk to your own physicians. Ask them if you have questions. The truth is there. Take this program and share it with 30 of your friends. Let them know and be aware of things that we share on this program. Well, thank you for watching the program today. We're glad that you are a part of this program. And if you have not contacted us before, would you just take a moment, sit down? Our address and contact information is on the end at the end of the program here. Let us know what you think about this program. Share with us how it has helped you. Many have, but we'd love to hear from you. Keep us in your prayers. Put us, join with us, partnering with us, and financially, so that we can keep this program on the air. And together, until next week at this time, take this truth, share it with others, stand in the gap for truth, which is what we say all the time. And we'll see you back here just 1 week from now.